Hi, my name is Sarah.
My name is Charity, and we will be doing sebaceous cyst excision. What are sebaceous cysts? Sebaceous cysts, also known as epidermoid cysts, are benign growths underneath the skin. They commonly appear on the face, neck, or trunk, but can occur anywhere on the body. Sebaceous cysts may develop as a result of trauma or when an opening to a sebaceous gland becomes blocked. The oily substance called sebum continues to be produced but can't escape to the outer surface of the skin, which then creates this pouch filled with cheesy consistency.
What is the purpose of the procedure? To remove an inflamed or infected sebaceous cyst, or to remove a sebaceous cyst that is not inflamed or infected but is located on an area of the body where the cyst is unsightly or where it may become irritated from rubbing. Sebaceous cysts can remain stable or they may suddenly grow. Sometimes they will become inflamed or suddenly rupture, and this process a risk for infection.
Why would a patient require this procedure? A sebaceous cyst may have no symptoms and are typically harmless. People usually seek removal because they don't like the appearance, or the cyst has ruptured or been inflamed or infected. Rupture is associated with sudden redness, pain, swelling, and local heat and can lead to abscess formation. Also, a history of inflammation often increases scar tissue in the area, making the cyst more firmly adherent to surrounding skin, which makes it more difficult to remove. Surgical excision is curative, but the complete cyst removal, including the entire cyst sac and contents, needs to be removed to ensure that the cyst won't reoccur. On the sterile field, you will need a syringe and needle for anesthesia, a curved iris scissors, a curved mosquito hemostat, a scalpel blade and handle, 2 tissue forceps, a suture material with needle, a needle holder, and a curved Mayo scissors.
On the counter, you will need fenestrated drape in package, antiseptic solution, gloves sterile and non-sterile, sterile dressing, bandages, tape, biohazard waste container, alcohol pads, sterile culture tape, and ruption and transport bag, wicking material.
The role of the medical assistant is to assist the provider during the procedure, such as assisting with drawing up anesthesia, blotting the surgical site, handing and receiving supplies and equipment, supporting the patient during surgery, and preparing lab specimen and requisition.
Steps needed for this procedure. First, we start with washed hands, assembled the supplies, and set up the sterile tray. Greeted and identified the patient, introduced self, explained the procedure, and checked for consent forms. Prepared the patient for procedure. Assist the provider during the procedure.
The next thing you want to do is provide post-operative care. You want to also clean and dispose of supplies and equipment appropriately and make sure you wash your hands. And lastly, correctly document the procedure. Here's an example. Enjoy!
Hi, my name is Sarah. I'm going to be your MA for today. May I please confirm your name and date of birth?
Charity Dubalos. My birthday is April 13, 2000.
Alright, and I see here you signed your consent form. And so basically the doctor will come in and he will make a small incision in the cyst, and then to remove everything inside, and then he will suture it. Everything will be okay. Could you please go on your scanner? Check it out. We need he will come in shortly. Alright, Charity, so the procedure was a success and the dressing will fall off within 24 to 48 hours and then you may take a shower. Don't try to take the suture away, it will dissolve by itself within 3 to 4 weeks. And everything should be okay. I hope you have a wonderful recovery.
Thank you
Let
so
us
much.
know if you need anything or any concerns. Yeah. Thank you so much.
Thank you.
The preoperative care is to prepare the patient by identifying their known allergies, tetanus status, and health concerns. Also, positioning the patient for comfort and safety, and applying the proper PPE and preparing the patient's skin.
Post-operative care. Applied sterile gloves. Cleaned area around the wound and dried the wound. Dressed and bandaged the wound. Removed gloves and washed hands. Checked patient's color and blood pressure. Gave wound care instructions, both orally and written. Symptoms of infection after our phone number. Assist the patient with concerns and questions. Arranged for follow-up care, medications, and schedule return appointment.
A sebaceous cyst does not require a follow-up unless a reoccurrence is brought to the physician's attention at a later date. Malignant growths may require a second procedure to provide a wider margin of excision around the lesion. It's quiz time! First question. True or false? Do all sebaceous cysts need to be removed? Question 2. What is the role of a medical assistant during the procedure? Question 3. What causes a sebaceous cyst to occur? Thank you for watching. Any questions?